Ladies and gentlemen, I am delighted to present to you today's topic of discussion, which revolves around the fascinating realm of general principles and preparation for physical examination. This subject holds tremendous significance as it forms a cornerstone in the process of diagnosis. So, without further ado, let us delve into this intriguing topic and uncover its intricacies. Below you can see an overview of the presentation's main points to give you a clear understanding of our planned activities. These consist of Introduction, Importance of General Physical Examination, General Principles of Physical Examination, Infection Control and Hand Hygiene, Preparation of Physical Examination, Patient Preparation, Physical Examination Techniques. Introduction. In this presentation, we will focus on the significance of physical examination in healthcare and its role in evaluating a patient's well-being and addressing medical conditions. We will delve into the core principles that form the foundation of physical examination and discuss the necessary preparations for both healthcare providers and patients. Adhering to these principles and guidelines is vital for precise assessments, ensuring patient comfort and trust, and facilitating effective communication among the healthcare team. Importance of general physical examination. The importance of physical examination in healthcare cannot be overstated. It serves as a cornerstone of medical practice, playing a vital role in the assessment, diagnosis, treatment, and monitoring of patients. Physical examination offers several key benefits. 1. Comprehensive assessment. It provides a holistic view of the patient's health, complementing medical history and aiding in understanding their overall condition. 2. Early detection. It helps identify potential health issues at an early stage, enabling timely intervention and preventing the progression of certain conditions. 3. Diagnostic aid. It assists in establishing preliminary diagnoses, narrowing down potential causes, and guiding further diagnostic tests. 4. Disease monitoring. It allows for the ongoing evaluation of a patient's physical status, tracking disease progression, and assessing treatment effectiveness. 5. Patient-provider relationship. It fosters trust, open communication, and patient involvement in their healthcare decisions, strengthening the bond between healthcare providers and patients. 6. Diagnostic efficiency and cost-effectiveness. It serves as a cost-effective diagnostic tool, reducing the need for unnecessary tests, imaging, and referrals. 7. Education and training. It plays a significant role in medical education, helping students and trainees develop clinical skills, diagnostic acumen, and an understanding of physical findings. In summary, physical examination is crucial for comprehensive assessment, early detection, diagnosis, disease monitoring, patient-provider relationships, diagnostic efficiency, and medical education. It combines clinical skills and patient-centered care to deliver optimal healthcare outcomes. General principles of physical examination. Patient consent and communication, privacy and confidentiality. Avoid unnecessary exposure and embarrassment. A patient may appreciate the opportunity to replace their top after examination of the chest before exposing the abdomen. Remain gentle towards the patient at all times, and be vigilant for aspects of the examination that may cause distress or discomfort. Acknowledge any anxiety or concerns raised by the patient during the consultation. Infection control and hand hygiene, patient comfort and dignity, respect for cultural considerations. The physical assessment of patients begins with the clinician's observation of subtle abnormalities in demeanor, gait, or appearance, even before the formal consultation begins. This observation serves as important clues, and the physical assessment itself can be likened to an investigative process. While modern technology has increased reliance on radiological and laboratory testing, the systematic and accurate physical examination remains crucial. The variability of physical signs and the need for repeated bedside assessments by different clinicians highlight the importance of a standardized approach to physical examination. Reproducible findings are essential. Additionally, the interpretation of diagnostic investigations and the detection of physical signs can vary between clinicians. The pretest probability, influenced by information gathered during the history and examination, impacts the utility of diagnostic investigations. Certain conditions or syndromes can only be diagnosed by identifying characteristic patterns of physical signs. By mastering structured skills in physical examination, clinicians can enhance the reliability and precision of their clinical assessments, leading to accurate diagnoses when combined with appropriate diagnostic investigations. Infection control and hand hygiene. The significance of infection control and hand hygiene cannot be overstated. Our primary goal is to minimize the potential transmission of infections, enhance patient safety, and maintain a clean and hygienic healthcare environment. By emphasizing these practices, we are dedicated to creating a safer and healthier healthcare setting for all individuals involved. Hand washing. Wet your hands with clean, running water. Apply an adequate amount of soap, liquid or bar. Rub your hands together to create a lather. Be sure to cover all surfaces of your hands, including the backs, palms, fingers, and nails. Scrub your hands for at least 20 seconds. Rinse your hands thoroughly under running water to remove all soap. Use a disposable paper towel or clean towel to dry your hands completely. Hand sanitizing. If soap and water are not readily available, you can use an alcohol-based hand sanitizer. Apply a sufficient amount of hand sanitizer to the palm of one hand. Rub your hands together, covering all surfaces, until the sanitizer has evaporated. This usually takes about 20 seconds. Make sure to reach all areas, including between your fingers and on the back of your hands. It's important to follow the specific guidelines and policies set by your healthcare facility or organization. Some facilities may have additional requirements, such as removing jewelry or wearing specific hand hygiene products. It is also crucial to perform hand hygiene before and after each patient contact to minimize the risk of spreading infections. Preparation of physical examination. Reviewing patients' medical history and relevant documentation. Gathering necessary equipment and supplies. Make sure you have the relevant equipment available, which consists of stethoscope, pen torch, measuring tape, ophthalmoscope, otoscope, sphygmomanometer, tendon hammer, tuning fork, cotton wool, disposable neurotips, wooden spatula, thermometer, magnifying glass, accurate weighing scales and a height measuring device, preferably a calibrated, wall-mounted stadiometer, personal protective equipment, like disposable gloves and apron, facilities for obtaining blood samples and urinalysis. Setting up the examination area for optimal conditions. The height of the examination couch or bed should be adjustable, with a step to enable patients to get up easily. An adjustable backrest is essential, particularly for breathless patients who cannot lie flat. It is usual practice to examine a recumbent patient from the right-hand side of the bed. Ensure the patient is comfortably positioned before commencing the physical examination. Ensuring proper lighting and temperature. The room should be warm and well lit. Subtle abnormalities of complexion, such as mild jaundice, are easier to detect in natural light. Confirming availability of assistance. If required, privacy is essential when assessing a patient. At the very least, ensure screens or curtains are fully closed around a ward bed. Where possible, use a separate private room to avoid being overheard. Seek permission from the patient to proceed to examination, and offer a chaperone where appropriate to prevent misunderstandings and to provide support and encouragement for the patient. Regardless of whether the patient is the same gender as the doctor or not, chaperones are always appropriate for breast, genital, rectal, or general examination. Chaperones are also advised if the patient is especially anxious or vulnerable, if there have been misunderstandings in the past, or if religious or cultural factors require a different approach to physical examination. Record the chaperone's name and presence. If patients decline the offer, respect their wishes and record this in the notes. Patient preparation. Establishing rapport and trust with the patient, explaining the purpose and procedure of the examination, obtaining informed consent, assisting the patient with clothing adjustments and positioning. Physical examination techniques. Inspection. This technique involves visually examining different body areas and systems to identify any visible abnormalities or signs of illness. It relies on careful observation and assessment of physical appearance, color, texture, shape, and movement. Palpation. Palpation utilizes touch to assess structures, organs, and tissues. By applying gentle pressure or using specific hand movements, healthcare providers can identify abnormalities such as swelling, tenderness, masses, or changes in temperature. Percussion. Percussion involves tapping or striking body surfaces with the fingers, hands, or specialized instruments. This technique helps evaluate the density, size, and location of underlying structures by analyzing the resulting sounds or vibrations produced. Auscultation. Auscultation involves listening to sounds produced by the body using a stethoscope or other appropriate listening devices. This technique enables healthcare professionals to assess internal organs and systems, such as the heart, lungs, and gastrointestinal tract, by detecting abnormal sounds, murmurs, or other indications of dysfunction. By employing these 4 physical examination techniques: inspection, palpation, percussion, and auscultation, healthcare providers can gather valuable information about a patient's health status, aid in diagnosis, and monitor the progress of treatment. Thank you all for joining today's discussion. We hope you found it informative and engaging. In our next session, we will delve into the topic of general physical examination, covering aspects such as the general survey, taking vital signs, and examining pain. We encourage you to stay tuned and be part of our upcoming videos. If you haven't already, please consider liking and subscribing to our channel to ensure you don't miss any future content. Until then, take care, and we look forward to seeing you in our next session. Goodbye, everyone.